Sue Chantry is one of the 21,000 newly recruited contact tracers. An occupational health nurse, she's currently completing her online training. And unlike most tracers, her clinical experience means she can handle more complex cases.
We will be working from home very much remotely with almost like a call system where we will then contact individuals and be able to give the guidance aligning with the public health information that we've been advised to give.
Contact tracers are just part of Test, Track and Trace, the political plan to help lift lockdown. But the UK's capacity to pull off that plan is once again facing scrutiny.
It's a very hard thing to achieve to get a well-functioning track and trace system in place. We need to be clear that that's working well. Without that, I think there's a risk that we would return to a situation where the epidemic might increase.
Testing is up, but not consistently hitting the 100,000 daily target. And although the contact tracers have been hired, they're yet to start. They will work alongside a new app currently being trialled on the Isle of Wight.
We were always going to download it, and I haven't come across anyone personally in my family or my friendship circle that hasn't wanted to. It's been more a case of on social media seeing people that are quite anti the app because they're worried about what that information is being used for and where it's going to go.
If a user gets infected with COVID-19,
but many say the UK is falling behind other countries. Singapore's app's been running for weeks, and South Korea has a highly effective track and trace system.
Country after country, from Iceland to Singapore, we hear that digital contact tracing apps are not necessarily the thing that makes a difference. What does make a difference is a comprehensive manual contact tracing regime that's really well resourced and has wide coverage.
Although labour-intensive, Test, Track and Trace has powerful potential. It could ease lockdown and prevent a second peak, but only if capacity is urgently increased. And that, say some, remains the challenge. Laura Bundock, Sky News.